An abdominoplasty or a tummy tuck operation aims to reduce the amount of tissue in the tummy wall between the chest and the pubic bone down towards the groin. And it's an operation that we undertake in hospital under general anaesthetic, removing excess skin and fat, and then occasionally also tightening the muscles underneath. The tummy tuck operations that we do are tailored to the patient's body shape and form, and specifically we look at where the excess tissue is. And they are often called either a mini abdominoplasty or a full abdominoplasty. And the full abdominoplasty may also be combined with something called plication of the rectus muscles. The rectus muscles are the six-pack muscles that we all have, albeit sometimes hiding underneath the tummy, that may have come apart because of age or because of childbearing, and these may need to be put back together and stitched. Tummy tuck operations I always carry out under general anaesthetic in the hospital setting, usually with one overnight stay. The operation itself involves making a cut from one hip bone to the other to undertake a full abdominoplasty. When everything's finished and the excess tissue is removed, everything's stitched up with absorbable stitches under the skin, and a surgical drain is left in overnight to take away any excess fluid and blood which may accumulate under the skin. For the mini abdominoplasty, I would often do this as a day case procedure. It doesn't usually require drainage afterwards and results in a shorter scar, usually in the centre of the abdomen, just above the pubic hair. We can also sometimes leave the tummy button attached. For a full abdominoplasty, we have to lift the skin and the fat off the tummy wall, and we have to reposition the tummy button. So the patient ends up with a scar around the tummy button, which is replaced in the normal position, and also a scar running across the bottom of the tummy, usually from one side, one hip bone to the other. Patients always want to know how quickly they're going to recover after surgery, and this really depends on the type of operation that we do. For the mini abdominoplasty or a full abdominoplasty without any stitching of the muscle, recovery is usually fairly quick, over a matter of 3 or 4 weeks. There are always risks associated with any form of surgery, and that may be bleeding, infection, and a significant amount of scarring that will be there after a full abdominoplasty. With an abdominoplasty procedure itself, one of the most significant risks is wound healing problems, where the wound simply doesn't heal, and this is quite common in the middle, right at the bottom of the tummy, where the tummy skin has been pulled down and stitched just above the pubic hair. The other complication that happens relatively early on is the formation of a seroma, and this is an accumulation of fluid underneath the tummy tuck flap, which may need draining with a needle in the outpatient setting. What we can always guarantee with a tummy tuck operation is that we're going to remove some of the tissue in the tummy wall, and therefore the overall bulk of the tummy wall will be reduced. At the same time, we want to combine this with producing an aesthetic shape, so try to recreate the curves of the lateral tummy wall and also of the midline. The combination of a tummy tuck operation with application of the rectus will also ensure that the resulting abdomen is thinner, and therefore from the side-on view is a much better shape.